It's being called an oral health crisis. Kent County is ranked dead last when it comes to kids receiving dental care at an early age. The Grand Rapids area once led the nation when it became the first city in the nation to add fluoride to its water system, but health officials say we have fallen far from that point. Now less than 0.5% of our kids get checkups by age 1, and a lack of access to dental care is a top concern for residents. Let's go over to Sue, who's got a hard look at the numbers and getting some more answers.
Brian, I'm joined in studio tonight with Dr. Colette Smiley from the Kent County Oral Health Coalition. Thank you for joining us tonight, Colette.
Thank you for having me.
Well, this is concern number one for you right now, isn't it? Dead last when it comes to young people getting checkups.
This is concern number one. As far as the report goes, yes. Medicaid eligible children under the age of 2 in Kent County are not receiving H1 dental exams.
Wow. Were you surprised when you heard that number?
I think everyone was a little surprised. Kent County is typically, and Grand Rapids, of course, is typically, we feel, we attack social problems head on, and it surprised a number of us.
Yeah. What do you think is the root cause of that number?
The causes are many and varied in regards to lack of access to care. Certainly there are economic issues, but there are cultural issues, there are transportation issues. Fear keeps people from going to the dentist.
Even for such young children, when they just get started in their young lives, you know, under 2 years old, we're talking about, does it seem like, well, they don't have teeth, there's nothing to worry about?
That's exactly it. The H1 dental exam is a new idea for many. It's a new idea for dentists, and it's a new idea for physicians, it's a new idea for parents and caregivers. And the Kent County Oral Health Coalition, in conjunction with the West Michigan District Dental Society and Points of Light, are working to educate all those communities.
Right. So, I mean, with just such young teeth, you know, where we're talking under 2, are there a lot of dental concerns, I guess, is my question, since, you know, babies are just getting their first teeth?
Right, right. And that's a very common question for new parents and caregivers. As soon as teeth enter the mouth, it's important that they are cared for.
So what steps do you think the Oral Health Coalition will take at this point?
Our focus is really twofold. One, we talked a little bit about increasing access to care, but two, prevention and education. Dental disease is preventable. It's preventable. So our effort, some of our efforts will be on focusing on prevention and educating our community that they can manage and take care of their own oral health.
So what are the solutions then? What will you be telling them that they need to do?
Well, we're going to go back to some very simple stuff. Brush your teeth twice a day for 2 minutes, right? Not exciting, but truthful.
Right.
We're going to talk to young parents about decreasing sugared beverages in cups and bottles as well.
Right, and juices.
And juices.
A lot of sugar.
Yeah, any sugared beverages, you bet.
Colette Smiley, thank you so much for joining us tonight from the Kent County Oral Health Coalition. Good luck with your efforts.
Thank you, my pleasure.